My name is Mary Alainga. I'm originally from Inuit. My whole family was born and raised up there. I come from a family of 9, 3 brothers and 5 sisters. My father used to work with corrections, and before that it was Northern Canada Power Commission. And my mom was a home mom. She took in boarders from communities and took care of them while waiting for hospital appointments. I first moved to Ottawa back in 1987 to work for ITK to see what else was out there outside of Iqaluit. And then I met this man. I met this man from Inuit, and he came to visit me in Ottawa. And since then we've been together. His name is Alainga Fraser. I moved with him to Bagotville, a military base, and a year later I moved back to Ottawa, get back to working and feeling useful. I felt useless in Quebec because I couldn't speak the language. I couldn't help anybody. I couldn't even talk to the children. Worked for Paututit, Inuit Women's Association. They allowed me to bring in my baby to the office every day I worked. And they were all women, so they took care of him when I had to do errands and go to the mail. So I moved back to Iqaluit in '95, lived there till 2002, and then we moved back here in 2002, and I moved here in March and bought this house in August, and we've been here since. When I first learned of cancer, it was up north. Inuit died of cancer. Then my mom got it. My mom got it in the intestine. My sisters, because I lived down here, my sisters and brothers took care of her, as well as my other family. Our father passed away in '94, so my mom was alone with her kids and relatives up north while I was living here. I helped. I tried to help in any way I could. I had friends who have died of cancer. I have friends who are survivors of cancer. I got good news today. The brain cancer has shrunk. Yeah! I'm so happy. My brain tumor is smaller now. My lung tumors are much smaller, from 8 millimeters to 5. And one has disappeared from the center of the bridge of my lungs. And so once I found out I had cancer a year ago, August 6th, my husband and I have been researching and looking for answers or how to comfort me and comfort others. And since then, I've been active in informing other people about cancer, how to get to take care of themselves, stay healthy. If you have family with cancer, be patient. You have to be patient because it's all different feelings. You got numb feeling, you have negative feelings, you have psycho feelings, you got the psycho and mental feelings are very, very strong. Sometimes you have to, no, you really have to get help. If you're struggling with cancer, how to deal with it, please get help, because the help is there. It helps. I was suicidal. I stopped thinking about it because the help that was there. They told me people have survived more bigger cancers than I have. So the only way to keep going is to keep fighting it. Pinch yourself and say, hey, I'm alive. I'm here right now. When I first got diagnosed, I was really scared. A nice lady nurse told me that I have stage 4 cancer. And since then, my life has been sheltered. I didn't want to share it at first, but I knew that I have to let people know that I have this cancer, that I'm going to fight it. The treatment started with 10 days radiation. From what I have heard, with radiation, you lose hair, you lose this and that. And so I was really scared. I wasn't losing any hair at first during the radiation, but after the radiation, when my hair started to fall out, it was very emotional. I was pulling my hair out, and it was just coming out. It's scary. It's like you feel you're crumbling to nothing. And with your family support talking to you and helping you and solving issues, problems. My nephew Lodi cut my hair. He used a buzzer and he cut it. And for about 9 days, I couldn't stop crying because I've had hair all my life. So this is a feeling cancer patients have when they lose their hair. They try to say something, but it's just, it's personal, but at the same time, and it's ugly. And then you forget it grows because it's happening right now. Then you learn to wear scarves, and also at the same time, you may lose your appetite, um, lose a little bit of loving, get angry, short-tempered, and very emotional. After the radiation, there was a break for a while, and I was getting these headaches and pain, so they gave me some medication, um, steroids, and pain meds, and another med. But they all help. The doctors are professional. They know what they're doing. This morning, my interview with my diagnosis, it was awesome. He called me and he told me my cancer in the brain has shrunk. And I believe that CBD oils that I've been taking has helped a lot because I take very little Tylenol and more CBD oil. But it's only 5 millimeters. It's not very much, but it helps. Since I learned that I have cancer, I was struggling at first accepting it. I was wondering, how long is it going to take to kill me? I have friends who have died of lung cancer. Listening to all the professionals, it was like foreign because it's English and I can understand it, but I could not take it and believe it in me. And then they started the immunotherapy treatment, and I was struggling because I'm claustrophobic a little bit, and the CT scan and the MRIs, you have to lie down and you go into a tube where it goes back and forth. But my eyes had to be covered. I struggled with going into X-rays or struggled going into CT scans and MRIs. They're very loud. They're noise like that, and 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 I had to have my eyes closed, covered with a towel, because if I could see something, I was going to move and run away from the machine. I know I would, but so with my eyes covered, uh, I laid still. Luckily, they didn't have to redo it because if you move with an MRI, if you go into 12 minutes and you move, you have to repeat the 12 minutes. Since the diagnosis, um, I reached out to some people. I reached out to TI at the health department.
Mary actually came to our program through her application to be on the Kagutik advisory group, and we selected her to join us on this journey. And she has been a contributing member from the beginning, always bringing a strong urban Inuk voice to the table. And we are really proud of us being able to implement a lot of the changes she wants to see. And now that she's going through the cancer journey directly, we're seeing more and more of her voice come to fruition through our work and her experience together.
I work for Tungusivinga Inuit Regional Cancer Program at Tungusivinga Inuit in Ottawa. Tungusivinga Inuit was created about a year and a half ago to assist our urban Inuit across Ontario to help them through patient experience, prevention, and screening. Thereafter, we established a Kagutik advisory group consisting of Inuit across Ontario. Currently, right now, we have Inuit that live in the city to help us and guide us through our deliverables and to assist our urban Inuit in their cancer journeys. There are many Inuit across Inuit Nunangat and here in urban centers that have cancers that look for support and guidance, and we've been able to fill that role to assist our urban Inuit in getting the help they need.
I'm the coordinator of the Regional Cancer Program at Tuknasmunga Inuit. I've worked in the program for a year and a half since its beginning. The program mainly focuses on two specific things, one being advocacy for urban Inuit, and the other being community-based programming related to our themes of prevention, cancer screening, and patient experience. On an advocacy front, we collaborate on a lot of research. We advise on a provincial and national level on cancer themes, such as the elimination of cervical cancer. We also work with provincial partners of other regional cancer programs, such as conducting a needs assessment on how they support their Inuit clients. And we also collaborate in other partnerships with other Inuit orgs or healthcare providers. On a community-based programming front, we actually created an Inuit-specific smoking cessation program where we held for 4 weeks a group of Inuit women who wanted to reduce or quit smoking altogether. And we created this program in partnership with Paututit and using their resources that they had created to create an educational but also peer support environment so that Inuit women have the skills and also the education to be able to decide if they want to quit smoking or not. We took a harm reduction point of view, and we are really happy with the results from that program and hope to run some in the future for other Inuit, both male and female, and hope that with reduced rates of smoking in the community, we also reduce the rates of cancer such as lung cancer.
Thank you, T.I., very much. T.I. was my shoulder for cancer. Julia Putulik, women's program, beading program, talking about our problems or happy times or hunting times or sewing, and learning how to sew and bead, using this tranquil support to lift my life, to lift the lives of people with cancer and others who just want to be with Inuit. I would like to share with the world that the physicians, the medical people are professional and they do help, and that my journey is believing in them. Although I have seen people pass away with the cancer, but the work that they do, like on me, it's minimized the cancer. It's going away. And so I would like for I'd like for cancer patients to follow the directions of the medical people. Take the support. Don't turn people away. And family is very, very, very important. Without my family, I think I would have be gone already. Like I said, it's been a year and 6 days now I've had cancer. When you find out, please share. Don't keep it, because it just eats you up from inside. And it may create another cancer. It may create another illness. Share and Don't be shy. Lots of people get it. So take care of yourself. I'm very grateful for my husband and my family. I'm very thankful to all my friends who have survived cancer, who have helped me, who has counseled me, who has told me don't give up, keep fighting. My friend, she had breast cancer, and she's still alive. And another friend who had breast cancer, who had it for years, has passed on. So you have to balance your life. Take care of yourself. Accept every day and live day by day. Um, if people ask questions that you think are stupid, give it back to them. Don't own it. It's too heavy. It's not yours to own. What you own is your health, your self-being, to become a healthier person.